started, they wanted to meet their donors. So when we told them that actually we would use their own hair, they were terrified. They had zero idea about hair transplantation.
You need to make an effort to find a patient in other things.
Why people want hair transplant is actually simple. They want to get their self-esteem back. If your expectations is not matching with that, you shouldn't have hair transplant.
Hi everyone, this is Dr. Erdoğan by Smiler Clinic and we are together with Dr. Gökay today. This is a new series, is called Real Deal, and we wanted to talk about many things the patients are curious about learning. These are our own experiences within so many years, patient stories, patient experiences, and also there are so many things that the people are looking and searching on the internet. That's why we decided about doing such a blog series. So we want you to follow in this kind of thing. So I would like to ask some from the general questions about Dr. Gökay, and we will talk about your questions in the other series.
Thank you, Dr. Mehmet. It will be a really nice and informative series, I guess. We gathered many questions from our patients and viewers, and I advise everybody, if they have their hair transplant with us or not, please follow us and try to gather this information. Also, you can find lots of this information on our webpage in the blog part. There are very specific topics about the hair transplant. So please go online and read them and follow us here. So we will inform you and give you very nice information. And also you will hear lots of funny stories about us.
Definitely. Okay, so let's get into it. So I would like to start with a very basic question, Gökay. Could you answer? Also, I'm gonna add some things to this, but what's hair transplantation? So why patients are trying to have the hair transplantation?
Actually, hair transplantation is a kind of organ transplantation. What we do is we extract the hair tissue behind the scalp, so which are resistant to testosterone, so they don't have a hair loss because of the testosterone, and implant them or transfer them into the zones of the scalp where patient gone bald or have a sort of hair loss and it looks thin. The question why people want hair transplant is actually simple. They want to get their self-esteem back. They want to look better because, you know, in the last 10 or 15 years, social media is really important in our lives. Everyone wants to have a nice picture and post it on the social media or look much better or younger. So with the hair transplantation, sometimes they look 10 or 15 years younger than they are.
They want to get their confidence and self-esteem back every time. I think they want to return to their looking 10, 15 years ago, and they can do it. And also, as an aesthetical rule, as you know, people wants to do things changing about their lives and their fashion, their face types. So it's a good thing to have a simple operation to do that.
Yes, actually, we hear from many of our patients that how the hair transplant changed their lives. Some of them had back to the gym, lose lots of weight, and have a new girlfriend, have a new lifestyle. So it may sometimes be very effective on the people to go back their young ages.
Yeah, that's right. We have so many stories. Probably in the other series we will explain the real patient stories and experiences about
that.
That
will be great.
It has a big impact on their lives. We are always talking together, but it's nice to share these things to the people who are watching this, so it will be beneficial, I think. Another question maybe according to this is, yes, we are doing hair transplantation in Turkey right now, but mostly hair transplantation is Turkey is a hair transplantation capital recently, and from United States, from Europe, from Western countries, many patients are trying to get their hair transplants here. It is easy because of the traveling is much easier. They can book easily, and Turkey is many affordable and easy to access, I think. But why a patient coming from United States or from UK or from Western countries to Turkey? We need to explain this part, I think, as well.
The story started about only the price. The first, when the hair transplant operations numbers increased in Turkey, it was mostly because of the price. Because Turkey had like 1/5, 1/6 of the cost of the hair transplant in the Western countries. But after it was 10 years ago. But after a couple of years, we as Turkey had a very big experience in the hair transplantation field. So actually it's not only about the price right now. We have many patients who had their first operations in the United States and they did not have a result or have a very bad result. They are not happy with the outcome. So they choose to Turkey to have their second operation. And every day we hear stories about that, how people see our results on the other people in the United States. So when they see, oh, you had a hair transplant, I cannot believe it, I cannot really understand it. And when they share our clinic's information, they directly book with us. So it's actually about the quality right now. So the Turkey's results are unmatching in any part of the world.
Yeah, that's right. We are operating patients every day. And we are just doing the hair transplantation, you and me. That's the reason we are more experienced in doing the same thing, actually. We have many physician patients from all over the world. Actually, we checked the data last week, I think, 162 countries we accepted patients from. Yes, the majority is the Western countries, but so many countries everyone is trying to come into Turkey. And as we are talking with the patients during the operation, we ask them, you are a doctor and you are visiting Turkey, you are visiting us, don't you have any friends that you can consult? And they always say that they are friends just doing 5 operations, 10 operations a month, and they are doing the other things as well. But that's the reason they think that we are more experienced about doing this transplantation every day. Yes, we know the theory is very important, but as we know in the medicine, practice is also very important. If you combine with the practice and theory, it'll be much better.
Yes, and also in many surgeries, as high number as the doctor performs the surgery annually, the doctor's complication and failure risk is significantly decreased. So I guess that's the most important factor on the Turkey's hair transplant achievement. I call this an achievement because it's really unmatched, and you cannot find this quality in any part of the world. And of course, you know, when we visit USA, UK a lot, and sometimes we share the stories with you, but people see us there and they say, hey, I know you, I'm following your clinic, my friend had a wonderful result with you, so he gave me your clinic's information and I follow you. We share these stories in Spain, even in Beverly Hills and other places. When you sit at a restaurant, people come, the chef comes and says, hey, I'm following your clinic, so I want a hair transplant with you.
Yeah, that's very ridiculous. I mean, I have experience in Bali. An Australian guy met my brother and he just said he's going to Turkey. I mean, whenever we are telling that we are from Turkey, people, I think, it's a little bit sad actually to say that. Turkey is related with a hair transplantation for a man. In Europe, I don't think it's like that, but in other countries, in the transatlantic or trans-Pacific countries, they usually match Turkey with the hair transplantation. So whenever we say we are from Turkey, they say, okay, I'm coming, or any friend of him is visiting Turkey. And when we say always that we are hair transplant doctors, they usually say, we know you, we know the Smile Hair Clinic. So it's good to see as a co-founder and co-owner of this company.
Yeah, I feel really excited and honored actually when I see them that they're already following us, or they already know me or you, and they want to come to our clinic. People may not know, but actually Turkey has been a hub for the medicine in the Eastern European countries, in the Gulf and the Gulf countries. People have been visiting Turkey for over more than 2 decades for the bone marrow transplantations, cancer surgeries, oncologic treatments, liver, kidney, or also even hip transplant and knee transplants. Actually, Turkey is doing very great in medicine, I guess.
I think that's one of the questions that the patients asking to us, and I think they are also curious from, we are receiving many requests from United States, from UK TV series or TV channels that they are always wondering why patients are going to Turkey. So it's another question that we are receiving. So I want to ask this question, and I want to talk about that too. Why Turkey is good in medicine, or they ask usually why Turkey is good in hair transplantation, but I think more generalized, why Turkey is good in medicine, so people are coming to Turkey.
I guess one of the reasons is that we have a system. After you graduated from high school, you go into a test. So in Turkey, it's not about the money. You have to be in the 0.01% in that scale to get into the medical school. So the Turkish medical schools only get the best of the best. And so we have huge hospitals and the Turkish medical schools really are known for their excellence and great expectations. Actually, you have to be in the 0.01, and even when you get into the medical school, it becomes much more easier to get in than to graduate. So yeah, we have a very, very effective medical education disciplinary system. Yeah, it's like army actually. Yeah.
But I think I can just make this topic to another thing that the patients always asking us the same question. I think it's very curious to learn why we get into hair transplantation. Why it happened with the hair transplantation. We know it better right now. Mm-hmm. We didn't know at that time, but why we choose it?
One of the reasons that I know you, of course, for many years, and myself, we were both interested in the surgery. But I don't know, some people love carpentry, some people love cars. Okay, it's like a hobby. And I was more interested in the surgical cases, especially fixing somebody. I remember that I spent 6 hours on a teenager that she had a trauma on the face, so she had many cuts. I had spent 6 hours to make perfect stitches and leave as less scar as I can. So these things always interested me, and when I started to learn hair transplant, I fall in love. So that's one of the reasons. So you need always to be passionate about your profession. I guess this is my reason, and I know it's one of your reasons, but it's better for you to tell it from your mouth actually.
I think at that time we have been so many years friend with Dr. Gökay, so we have common interests, we have common things that we follow together, and we started with the medical tourism administration. As actually, yeah, we were doctors, we were practicing as a physician, but on the other side we have some other duties like medical directory, and because we speak several languages, that's the reason we wanted to be in part of the medical tourism, which was starting newly. Yeah. And do you remember, of course, at that time we were trying to make some marketing and sales team leadership as well. And we were trying to find patients at that time, but it was very hard. Yeah, it was not, it was 13, 14 years ago. The internet was not too great at that time. You can't do very online things, and you need to build offices in other countries to get the offline patients, which bringing their medical records to the office. You were having the medical second opinion. Your team is giving something.
On-site marketing, yeah, it was very hard.
Yeah, and also we were the responsible of the whole head and checking the medical second opinion if the treatment plan is right, if the calculations are right. But at that time, I think understand and we noticed something. You need to make an effort to find a patient in other things. But we noticed, and everyone they were criticizing us actually, when we said, there is hair transplantation and there are so many patients have demanding on coming Turkey. but there were not too many doctors. And we say, okay, if there is not too many doctors, we can, I mean, it's a very new thing. We can learn it, we can understand it, and it's easy to find the patient as well. Because whenever you meet with someone, we are traveling so much, I think, and we are always kidding with Gökay about we want to travel too much because we are talking with the patients, the potential patients, because everyone is potential to us.
Yeah.
I think it is very important from that time till this time we have the vision of seeing this, and we accepted to have the training of the hair transplantation.
Yeah, and maybe something we missed here. We are both a little bit perfectionist. Okay, when we try to do something, we really don't like the other ones did before of us. We want it to be perfect. So when we see the hair transplant patients and when we started to treat them, we understand that still Turkey needs an improvement in the process of the hair transplantation, and we both sit together and talk that we make it perfect. We can make it perfect. We can do many improvements in this field, and we can build the great clinic. So I'm pretty sure that if it wasn't hair transplant, we could do still something perfect together. We could still make many improvements, and at that times were really hard because the all hospital's burden was on two of us, and it was 200 beds hospital with many patients. So it was really hard times, but at the end we find our passion, I guess.
And also, Gökay, do you remember that at that time there was not too many doctors, and we said, okay, why there is not too much information, not too much literature, and also not too many people knows about the hair transplantation. And we have classmates, they all, when we said that we are going into the hair transplantation procedure trainings, everyone was laughing at us. They
make fun with us.
Yeah, because they are cardiovascular surgeons or brain surgery, orthopedics, and they said, okay, we are doing such big, complicated surgeries, and you are just Mehmet or Gökay. They always saying to us, are you just doing the hair transplantation? After many years, right now, whatever they are saying, that we did the right thing. Yeah. They are always said, okay, you did the right thing at that time. We said so many things, but now the world is getting into aesthetical part. That's the reason it's more important, I think.
Yeah, actually, whenever I go doctors with my wife or kids, the doctors always, when I'm saying I'm a doctor, they ask me what is your specialty. I say I'm doing hair transplants right now. So they say, oh, this is the best, because now everybody knows Turkey is great in hair transplant, and they know us. Sometimes even the doctors we go say, hey, I know you are a hair transplant doctor. So that's really great for us that we find our passion, and it paid back well.
I think in the medical aesthetics, there are other plastic surgical things, as you know, liposuction or breast augmentation or facelifts, other things. I think hair transplantation is, because it's more men oriented. Yes, most of the patients, 99% of the patients are men, and I think with men it's much more easier because I mean it's more easy to recreate the hairline. It's more important to do the similar things that they had before, and there are also some options, but in other aesthetics I think it's a little bit hard to get into it, and more complicated, I think.
Yeah, patients cannot know what will be the result, what will they look like with the result. Even there are some computer programs that they create or try to foresee the results, how it's going to look like. When they have it, they may not like it. But whenever we operate a patient, I have never heard a patient is disappointed getting their hair back. It's really important.
And I think maybe it could be a gender thing, but I think we need to tell this thing, because I'm always telling this to the patients as well. Now, we are every day with the consultations with the patients. Because we have a authority, we have a experience, enough experience. Everyone is coming to our clinic. We are asking, what's your expectation? What's your request? What you expect with the surgery in the future? They always say, you know better.
Yeah, you are the doctor, you know better, I know you very well, I
Yeah.
come here trusting you, so you do your best, and that's all.
I think it's a better communication and easier communication. I
Yeah,
think.
it's really easy. So at the first years of the Smile Hair Clinic, it wasn't like that. They were when we explained them, it shouldn't be like that. The hairline shouldn't look like that. They had a certain thing in their mind, so they didn't know us very well. So they were insisting to have that unnatural hairline or unnatural shape. But now, since they know us very well, they simply leave it to us, and we are very lucky that we have that experience. They write to both of us that they are very happy at the end. They find us on the social media, or we usually give our personal cell phones to reach us whenever they want. And actually, they are.
Is there a social impact that you think? Yes, we are maybe also different, as you know, as you're saying. It was 8 years ago different, 10 years ago different, now it's different. But I think it's not only with us too. It's also the content, the social media effect. There are so many information, so many content inside. So they know, I think, they listen us before coming here.
Yeah, like when we started, first started 10 years ago, there were not enough information on the web. There were not many people coming on the daylight that they would say they had hair transplantation. They were trying to hide it actually. Now, when people come here, they know who you are, what you have done before. They know everything about the hair transplant, so they know what to expect, what not to expect. Because someone, as you remember, people were always asking us they did not have any hair on the scalp and they wanted the full head of hair in one session. It's impossible. So now people
talk
are
about that too. There are other things changed as well after the COVID or recent years. We need to talk about that too. That's right. I mean, Gökay, it's changing. We have more content. Even now, what we are doing right now is we are trying to explain many things inside this series to the patients. Before, it was not very easy to create such a thing.
And from the first day, I want to tell to these two viewers, we decided with Mehmet, always tell the truth, always
More
give
realistic.
realistic expectations, and we always try to avoid the people whose expectations is not matching reality, and they would be unhappy. Because when you are having a hair transplant, there are some, I will not get into technical issues, but there are possible outcomes. If your expectations is not matching with that, you shouldn't have hair transplant. Actually, this is true for all operations. If the reality is not matching your expectations, then don't have the aesthetic surgery.
In addition to this, do you remember in the beginnings, in the 10 years before, everyone was more oriented on the graft numbers.
Yeah.
They were always telling us, this clinic offered me 5,000 grafts, but you are telling 4,000. Maybe we were just doing that number, it was safe for the patient, or the other clinic was giving wrong numbers to them, because
Just to lure the patient.
yeah, exactly. But I think now we don't see that too much. Probably they know the graft number is not too much important, and
Because we had spent many years explaining.
exactly.
The graft number is we always say that the graft number is an outcome of the donor zone size and the donor zone density. If we two have the same donor zone density, then my head is bigger, then my graft number is bigger. But if my donor zone is bigger, then my recipient zone is bigger, so density will be still same for both of us. So people know this now. Okay, it wasn't like that before. Yeah, you are totally right.
That's right. And also, I think it's more important with less graft number to cover more.
Yeah, that's that's the magic. Yeah,
If you can cover with less number, I think
that's always better.
so. More graft number doesn't mean anything as well in the particular area if we just do that.
They don't just grow. That's it. I guess we spent a lot of time to explain this to people, and in many points we are successful about this.
That's right.
We give them a lot of information on our webpage, on our blogs. If they read it, they can understand it. And
Case studies as well.
Yes, they put their hands on the info. They're trying to put as much as information as they can. And that's funny, actually. Do you remember a couple of patients when they come here to our clinic? When we first started, they wanted to meet their donors. So when we told them that actually we would use their own hair, they were terrified. They had zero idea about hair transplantation, but
It's
just
less
came.
right now.
Yeah.
That's right.
Yeah.
It's less right now because there are more patients. It is, for example, 10 years ago, I think it was 35, 40, the range the age interval. Now it's more 25 to 27. It's so we are having more young patients. We are having less bald patients. Do you remember it? That when we first started, Norwood 7, Norwood 6, last stage patients, but now it is just they are just coming for small lowering hairline too.
Yeah, because I guess it's getting much more important right now, the outlook for the people, especially for men. Before, like 10 or 15 years ago, men's outlook was not a main concern. It wasn't matter. They were just shaving the remaining hair and they were going bald in their 27s. It didn't matter for them. But now everybody is, especially after the COVID, are really concerned about their outlook.
Especially during the COVID, it happened, I think, because more people stayed in the home. They were more related with their selves. I think they are looking more to the mirror. They are seeing other people, and they are, I think, more concentrating on themselves. So after the COVID, do you remember? It is very high impact on patients were trying to come immediately.
Yeah, we needed to deny many patients every month because we were totally booked.
Yes, probably this social media impact or visual age impact, plus I think they don't want to postpone it or they don't want to delay it. They want to get it now. They don't want to make this happen in the future. So they said, okay, it's easy. They can travel 10 hours, 11 hours from US or from Australia. It's very Turkey is middle in the world.
Middle of the world, yeah.
And there are frequent flights, so they just book it. Even 2 days, 3 days later, they just can come to Turkey, do the transplantation, and go. So that's the reason. I think it's much easier. Before, do you remember the conversion times of the patients? For example, when they apply to us, we have some systems in our clinic that we can also. We like the data in the clinic, so we are following these kind of things. It was 2-3 months. Even some patients were doing the treatment plan for 2 years later, 1 year later. Now, even one week ago, they just do the booking and they just come to clinic. It changed a lot.
I guess it's much more instinctual right now because maybe people had see that the postponing things is not good, so it can end now. Even I'm thinking about like that. Before that, I had a great wine to consume in a very rare occasion, but now I don't do that. I always try to live the best every day in my life. So maybe people had that too.
The reason I'm asking this question is because sometimes I'm seeing other surgeons in US and other places that is criticizing that kind of all-inclusive packages. So, for example, if I'm a patient, even I mean, sometimes we book some tours. We want to go with tour companies to somewhere. We don't want to arrange a transportation. We don't want to arrange even the hotel or even other things. They are not coming here for pleasure. So they have a dedicated just hair transplantation. So I don't want, for example, as a patient, I'm enough not comfortable to go and travel to somewhere to have some medical thing. And I don't know what's going on. So everything, if it's more organized, it's much more easier for me. So patients are coming, they are picked up, they are in the hotel, they just come here. And also there are other guys in the hotel or there are other guys in the clinic that they can
interact.
They interact, they
and
share
become
their
hair
experiences.
transplant buddies.
Yeah, we have so many patients who met here
and become close friends.
Become close friends. We are even close friends with them.
Yeah.
So I think it's a buddy system, and it's a patient buddy system actually.
Yeah, we
which
have
is a
it
very
in scuba diving.
we're very comfortable because I think in the hotel when they meet with a previous patient from yesterday, probably they are curious. They are approaching at the breakfast or in the lunch, and they are asking how was it. So main question, I think the main question is it painful? So when they said no, it was okay. It's a good thing. It's a good start.
No, that is not a painful. It's not.
If it's painful, it's a bad start. It's another issue. But of course, we haven't been a patient. We don't know what the patient feels about that. But you have so many patients. I have so many patients. We are hearing from the patients feedbacks that they always say they waited enough because it was painful. But if they knew it before that, it was so easy, they would do it before.
The thing is that when you go online and check the comments, you may see a horror story, because the people who are going online and posting that it was painful are the people mostly it's painful. I want the people know that we use local anesthetics and they're in acidic nature. So as soon as they penetrate into the tissue, they make a sense of burning. For some people, it's nothing. For some people, it makes a little bit pain, but it's okay. For some people, it's painful. So the people who write comment about it are the people who think that it's painful. It depends on their pain threshold, of course. But since even if they are a very minor group of the hair transplantation patients, they make a greater impact than the people who think that it's not painful or it's moderate. Okay, so I had really two covered friends. I had been chasing them for 5 years, and suddenly out of nowhere they decided to have hair transplants, and I made their hair transplants. And the first thing the next day they told me is that, if I knew that it was so easy, I would have this before, many years before. So I told them, you are covered, okay? You had to come. I told this to, even if they are my close friends, now they have full head of hair, their wife's happy, and they are happy. And by the meantime, now, since you mentioned, I want to ask you, why do other surgeons in the Western countries try to make a very negative impact on the hair transplant surgeries in the Turkey? And since we had been in the meetings of the many associations, you can maybe tell us why they spent 1 day of the 3-day Congress to find a way to ensure people Turkey is bad and not to go there.
I think that's the most important question. Very simple question, a very simple answer. Then I will explain. But simple questions and simple answer is they don't want to lose the patients. That's the first. I think that's whatever I can say in the end, I can say in the front. But yes, I mean, Turkey becomes a leader. It has a own reputation which grows naturally. It has not an effect of the digital marketing or another thing. Patients, so many patients. I mean, we are seeing some data from Turkey government or other things. 1 million patients a year is coming to Turkey. This cannot be a surprise, or this cannot be another thing. So many patients are coming to Turkey, so there is something.
This is not a coincidence.
Yeah,
this is not random.
Yeah,
okay?
This is not random. Yeah, so you can't affect the people's coming here. So maybe they think that they are coming for cheaper prices or other things. Maybe in the beginning it was like that, but now because we are doing more and more, we are much better. We are looking to other surgeons as well. I mean, we are following. You follow, I follow. We have been in other congress. We also see them when they are operating the patients. It is about the practice, I think. Yes, but theoretically, I agree. Very many surgeons do everything. Maybe then they know it, but because when you don't combine it with the practice, it doesn't happen. That's the reason, because we are doing it so many. And Gökay, from all over the countries, I want to repeat it again, 162 countries, we do operation in 2024 from these countries, from everywhere. I mean, even
In the world, in
even
every
we
corner of the
haven't
world.
we haven't heard, because it's our fault. Maybe we haven't heard that country, but when it's coming from a different country, he says that you are the best guys. So that's the reason I'm coming. He didn't go to US or another place. He's coming to Turkey. So why do you think it's the DHI is more coming as a question to us always?
Because people are promoting that it's like a
It's
very
like a recent-
it's like a recent method. No, it's not.
It's not, yeah.
Like it's superior. No, it's not. Is the lateral slit method superior? No, it's not. They have both some advantages and disadvantages.
That's right.
I always tell the patients that whatever you have, it doesn't matter. Okay, the experience of the team and the surgeon is the most important thing. Why the clinics or the people are trying to promote the DHI? Because it's not needed by a very you don't need to be very skilled to perform it. So you can start new
And with less teams you can do that.
Yeah, with less teams you can do that, and the doctors sometimes are less involved into that. So, in my personal opinion, and I know you, okay, we both think that a good FUE is better than DHI.
That's right. I mean, in the right patient selections, we can accept DHI is superior to the other, like non-shaving, just a small part without shaving, and you just want to increase. But if you want to go to density, if you want to go to right direction, right angles, I think it is a little bit dull.
Yeah.
The implanter is duller, more dull than our microblades, because in the microblade we do with the right precision, in the right angle and right direction and right density, then we implant them. Yes, it is much better to have the better natural results, I think.
And even with the DHI, in Turkey, they still, and we also, still, if the patient wants to have the DHI, of course, we perform, but we still use slit method for the hairline design, because it gives a better result with the slit for the hairline designs.
Yeah, I totally agree. That's the reason I also prefer more FUE. Even I'm telling in the not right
we
way.
can tell that, because if you say lateral slit, people will not understand. Probably. Yeah, if you're using FUE is better.
So it's better to choose actually that thing. I think we can have more medical things, like, for example, I'm receiving too much about, and I think patients are very curious about that. They can find this information in different videos, but how many days later a patient is returning to his activities, his work, his daily life? I think most of the people are afraid of what's going to happen after the operation. So we need to explain that thing as well, Gökay, I think.
Actually, you can turn back to your normal life one day later if you are not really concerned about your aesthetic look. But the thing is that
the workers we do here, we make them to work next day.
The thing is that it's always better to rest a couple of days, because one of the symptoms that after the hair transplants we see is that the swelling on the frontal part of the face. You know, when we do hurt some part of our body, it's got swollen. Because it's the normal process of the body is to protect itself
against trauma.
Against trauma, of course. So what happens is, when you have hair transplant, you cannot beat gravity. Nobody could.
Yeah.
So when you stand up, the swelling starts to go down, 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 especially around the eyes, because we call that orbita. It's the thinnest part of the facial skin.
And also, it's like a space.
Yeah. So whenever you get old, you have that eye bags under your eyes. So that's one of the reasons.
But not everyone will see the swelling.
Yeah, of course.
I mean, just 20%.
Yeah,
maybe.
Maybe it's a little bit less. Okay, because we give anti-inflammatory drugs, and to be most precise, like 99% of our patients do not mention about the post-operational pain. They are very comfortable even in the night, because one of the things that they ask before the operation, when will the anesthetic will wear off? So it's one of their concerns. We must say that also they have a comfortable night. 3-4 days resting is very good. If you are not working in a physical job, physical labor job,
Or direct sun exposure.
yeah, our direct sun exposure, you can turn back to your work. Even the next day, you can lie on your back and use the computer and
office work is
office
always
work is
possible.
always, yeah. And after 10 days, we say our patients that they can wear any hat, and they remove the cross like after 11th day, so it's looking much more better. It's almost like they got their hair instantly. And for a week, they sleep carefully with a neck pillow. We provide them here, so we teach them how to sleep, so they do not lose any grafts on the pillow. Like 10 days is the maximum length that they need to be careful. Also, we must say that you guys must know that your grafts will be attached to your skin from 5 to 10 days. But as doctor, we always love to be in the safe part and say 10 days. And one thing I should add here about the elastic bands, most of the clinics use after the hair transplants.
It was a common thing before, right?
Yeah,
in all clinics.
In all clinics, guys. Even if your doctor tries to put a headband around your head, don't do that. Please say I don't want that, because it decreases the survival rate of the grafts significantly. Plus, please try to avoid the headband, okay? So when it happens, the swelling decreases the perfusion rate of the scalp, so it decreases the survival rate of the grafts, so don't use that.
That's right, yeah, Gökay, there are so many things that we need to talk about. I
Yeah,
think
and
it
we will
takes
talk. I like this one actually. It was
several hours.
I like this. And
we are very talkative. We wanted to talk and explain everything.
Yeah.
That's very good for who is viewing these things. So we will continue about these series with. We have so many stories with the patients. I think they are very. Just follow us on those topics, and it's very interesting things that we need to talk. We can even write a book about that in the future.
Exactly.
Probably we should collect these kind of things. So in the next series, we will be talking about our patient stories and other things that you are also curious about to learn. But if you still want to learn other things we wanted to answer here, you can just write on the comments below, and we will be searching, and we will be also answering those questions. So, Gökay, thanks so much for your time today.
It's my pleasure to always chat with you.
Yes, thank you so much. Have a nice day.